So the long-term plan, which was published in 2019, outlines a vision of the National Health Service across the UK that is more joined up and coordinated. It is more proactive in the service it provides and more differentiated in its support for individuals. Meeting these goals means transforming the NHS workforce by reshaping our teams around the needs of our populations. And the plan puts advanced practitioners as a key role in this transformation across acute, primary, community and social care. So over the last decade, various strategic policies have been published aimed at standardising expectations of advanced practice across the health and care sectors, providing assurance of the capabilities and competence of individuals across all 4 countries of the UK. So a key driver for the implementation of advanced clinical practice is to enable practitioners to practice to their full potential and to optimise their contribution to meeting population, individual, family and carer needs through different models of service delivery and multidisciplinary working. There are currently no consistent, systematic measures to capture the number of people working at an advanced level of practice across the countries of the UK, across healthcare organisations and sectors. In terms of how the scope of practice has evolved in the UK, the profession secured professional autonomy in 1977, and it was some 30 years later where the CSP, the Chartered Society of Physiotherapy, agreed a new definition of scope of practice, which makes it clear that associated activities such as the use of various diagnostic resources, prescribing and injection therapy are linked to are within the scope of physiotherapy. So as Reena described earlier, there's no definition of advanced practice that is both standardised and accepted across the UK. Advanced practice is a level of practice rather than a specific role. But what we do have across the UK are 4 separate framework documents reflecting the 4 countries of the UK. These were developed with the aim of providing practical guidance on non-medical workforce development to ensure services continue to meet evolving patient needs. So although the differing frameworks have differing content, they all provide the following. They provide the capabilities that are required across the 4 pillars of advanced level practice. These are clinical, leadership, education and research. They outline the education and support requirements for advanced level practice, and they provide advice for employers with regards to planning and implementation. Within the framework of all 4 countries of the UK, the necessary education provision to support working at an advanced level of practice is stated to be master's level or equivalent. The CSP advocates for multiple and flexible routes through which individuals can develop capabilities. These include work-based learning, access to high-quality courses and modules, along with higher level apprenticeship programs in England and traditional master's degree programs. I'm going to speak more specifically about the England offer now. So in England, to address the variation in education, a Centre for Advancing Practice to support and develop nationally agreed education and training standards has been created. A similar or alternative approach to addressing education standardisation has not yet been published in the other nations of the UK. In England, the multi-professional advanced clinical practice framework sets out a new and bold vision in developing this critical workforce in a consistent way to ensure safety, quality and effectiveness. It has been developed for use across all settings, including primary, community, acute, mental health and learning disabilities. This framework requires that health and care professionals, it's multidisciplinary, multi-professional, are working at the level of advanced clinical practice, should have developed and can evidence the underpinning competencies applicable to their speciality or subject area, i.e. the knowledge, skills and behaviours relevant to the physiotherapist's setting and job role. The core capabilities across the 4 pillars of clinical, leadership, education and research are then applied to these specialist competencies. How these are demonstrated will vary depending on the profession, the role, the population group, setting and sector. A key work stream for the Centre for Advancing Practice is to oversee the development and quality assurance of multi-professional advanced practice credentials to address high priority at-scale workforce development needs. Credentials are used to describe standardized structured units of assessed learning that are designed to develop advanced level practice capability in a particular area. And these credential specifications are intended for delivery by education providers. Credential specifications include some of the following areas: acute medicine, community-based rehabilitation, end-of-life care, learning disability, mental health, older people, pelvic health, public health. So the Centre for Advancing Practice have developed these credentials that are specific to these patient pathways of care. So to finish really, advanced practice embodies the ability to manage clinical care, deal with complexity, multi-morbidity. It offers continuity of care for individuals, families and carers. It enables innovative solutions to improve service user experience and outcomes. And it also allows redistribution of workloads within a multidisciplinary team, building decision-making capabilities. This helps great clinicians stay in clinical roles as their career progresses. And evidence consistently shows that well-planned multi-professional working is more effective and satisfying for the workforce, with the potential to improve retention rates across staff groups and patient care. Thank you.